Magandang hapon po sa ating lahat. Live na live po tayo sa Facebook with our participants, speakers, and viewers. Welcome to today's webinar entitled Facing the World, an Overview of Cleft and Palate Surgery. I am Rina Ramirez and joining me with my co-host, Ina Sadsat.
And welcome and thank you to everyone who joined us through Zoom and Facebook Live today. I am NCFPI patient and volunteer Ina Sadsad. Thank you to all of the volunteers, patients, and parents who attended our sixth webinar for this year. We appreciate your unwavering support for the activities carried out by the NCFPI.
That is so true. For sure, marami tayong matututunan at ang mga participants natin dito sa Zoom and Facebook Live. This webinar is for all. Mahalaga na magkaroon tayo ng dagdag kaalaman tungkol sa comprehensive cleft care. NCFPI provides comprehensive, continuing care of patients with cleft and craniofacial anomalies, especially indigenous Filipinos for 15 years. Ikaw ba, Ina, ano ba yung mga operation na natanggap mo from NCFPI?
5 to 6 years ago, I had a bone graft surgery by Dr. Tansipik, and it served as a precursor for my braces, which is done by Dr. Janet Pandan, my orthosurgeon. And with that, currently I am scheduled for another surgery to align my bite. And with that, I'm very thankful for the foundation and my doctors, the nurses, the staff, and the assistant for being very heartwarming, nice, and very approachable. And with that, well, before we begin, we encourage everyone to share, react, and comment on our Facebook live stream.
That is so great to hear, Ina. Alam ko na marami ka rin pinagdaanan and ako bilang isang mental health advocate and a volunteer here in NCFPI, my desire is makita yung mga bata at mga pasyente na nasa mabuting kalagayan at kaya iahon ang sarili para maabot nila ang kanilang mga pangarap. Kaya naman i-share nyo ito sa inyong mga Facebook page and group so that more people can learn from our advocacy for the cleft community. Now we're gonna hear a wonderful testimony from one of our NCFPI patients. She is a graduate from Emilio Aguinaldo College with a degree of Bachelor of Science in Criminology, and now she is employed by the Department of Interior and Local Government, also known as DILG. Without further ado, let us all welcome Ms. Gwen Bas. Nakamute ka po.
Ayan, sorry po. So, okay na po, no?
Yes.
Okay. Okay, so good afternoon everyone po. Sa mga participant din po natin, good afternoon po sa inyong lahat. And ako nga po pala uli si Gwen Bas. Currently living at Dasmariñas, Cavite, and I'm 22 years old po. So I'm here po talaga na sinabihan po ako na mag-share nga po ng story, and it's my pleasure po talaga to share my journey as a cleft palate patient po. Yun nga po, mag-start na po ako. Okay. So, pinanganak po ako na may cleft palate, March 29, 1999. So, pangalawa po ako sa mga magkakapatid at isang babae lang po. Bali yung first operation ko po, nung 5 months ako, which is yung lip. Then, bago mag 1 year old, sorry, after 1 year, yung ngala-ngala naman po. Then, si Dr. Tansipik po ang surgeon ko noon. Tapos, third operation and fourth operation, yung bone grafting naman po, done by Dr. Velmonte po. Doon na po nag-start yung journey ko sa Nordoff po, no? Tapos, 2011, grade 6 po ako. Yun po ang unang bone grafting ko. And first year high school, yung second bone grafting ko. During my journey talaga talaga nung mga panahon na yun, hindi madali talaga yung pinagdaanan kasi the fact na yung mga bata or tayo na may cleft palate, kadikit na talaga natin yung pambubuli, which is hindi talaga maaalis. And hindi naiintindihan ng ibang tao na yung totoong nararamdaman and pinagdadaanan ng mga may cleft palate. So, those times talagang hindi naging madali para sa akin yung pakikipagsalamuha sa bawat isang tao at nandyan yung uuwi ka na malungkot ka kasi nandun yung nabubuli ka. But then, hindi ako nagpatalo sa mga taong nambubuli at yung mga nandadown, of course, syempre. At ang pinakamahirap na everyday na tinatahak ko talaga is yung pambubuli, judgment, lalo na yung doubt ng ibang tao. Pero sinabi ko sa sarili ko, dalawa lang yan. Kailangan natin mag-isip ng dalawang side. Kung yung isang side, hahayaan mo yung mga taong bulihin ka or patunayan sa kanila kung ano yung iniisip nila. Or pangalawa, patunayan sa kanila na mali sila. So, meron lang akong i-share na key. Ito kasi yung key na ginawa ko talaga those times na tinatahak ko yung journey ko bilang cleft palate patient, no? So, mag-share lang ako ng ito. Share ko lang po yung sa screen ko, ha? Okay. Nakikita po ba?
Yes.
Okay. Ayan. Meron akong tinatawag na fats. Yan. Siyempre alam ko mataba ako, pero yung fats na yan is yung F stands for family support, okay? Sa mga ibang participants po natin, I encourage po talaga na number 1 talaga is magsimula sa bahay, which is the family support. Kailangan talaga ng suporta ng family, lalo na dun sa mga ibang tao. Kasi bago siya ma-accept ng ibang tao, family muna talaga yung magbi-build ng support dun sa mga batang may cleft palate. So yung A naman is acceptance. I-accept natin yung fact na nandoon na yung mga nambubuli. Pero let's sabihin natin sa kanila na cleft palate is not the limitation for that thing. Na yung cleft palate hindi lang doon natatapos kung anong meron yung tao. And yung T is try something new. Huwag tayong matatakot sa judgment. Nandiyan na yan. Yung try something new na yan, lahat ng tao gusto ng bago, lahat ng tao gusto ng another achievement. So yung judgment na sasabihin sa atin ng tao, okay lang yun eh. May gawin ka o wala, may sasabihin talaga yung tao. May gawin kang tama, may masasabi. May gawin kang mali, may masasabi. Judgment, okay lang yan. And yung S is for strive. Everything takes time naman po eh, di ba? Pero habang tinatahak natin yung journey natin, mag-focus lang tayo dun sa bagay na gusto nating, sa gusto nating marating. So, gusto ko lang share yung key na yon, yung FATS na yon. Dun kasi sa may FATS na yon, yung family support, which is sobrang swerte ko na lang din kasi nakuha ko talaga siya sa family ko. And yung acceptance, tinanggap ko talaga sa sarili ko na yun eh, may cleft palate, okay lang yun. Yung try something new, sobrang takot na takot ako magkamali. Sobrang takot ako sa judgment ng iba. And try something new, gustong-gusto kong mag-try ng ibang bagay. Pero walang masama kung magta-try ng bago. And sobrang laking factor na mag-strive tayo kasi dun sa pag-i-strive natin, hindi natin napapansin na malayo na pala yung nararating natin, although na normal na nagkakamali na yun nga, may masasabi ibang tao, pero we keep aiming na lang dun sa strive natin, we keep aiming na lang dun sa goal natin. So yun nga, and for the update na lang din dun sa journey ko sa Nordoff, Bali ang last consultation ko is kay Doktora Velmonte, which is yung jaw surgery nga po. At, sobrang laki lang din talaga ng tulong ng Nordoff sa'kin. Lalo na sa katulad naming mahihirap na hindi talaga kaya hindi talaga afford yung mga operation na ganyan. Kaya sobrang nagpapasalamat po talaga ako sa Nordoff at naging bahagi sila ng buhay namin. Yun lang po. Thank you po.
Thank you, Miss Gwen, for taking the time to share your journey with NCFPI. I'm sure maraming patients ang na-inspire sa journey mo. And it shows na whatever hurdles or obstructions we face in life, life goes on. And ayun nga, tama ka nga na sa family ang nauunang support. And with that, di ba, criminology student ka rin. And that shows na di naman siya hadlang talaga. Parang we can go on and achieve our dreams in life. Like me, I'm a pre-med student and planning to be a doctor someday. So, di naman siya hadlang. I can ace my exams, I can top my exams. So, this shows us na we can do it naman talaga with family support and with the acceptance nga. So, ayun po. As we continue our webinar, it gives me a great pleasure to introduce our speaker today. She is one of the founders and current board of trustee of NCFPI, Dr. Xenia Velmonte. Dr. X.
Thank you, Ina. Like I said, when Jessica was asking me how to introduce me, the simplest would be to say that I'm a founder of Our Lady of Peace Craniofacial Center, which predated Nordoff Craniofacial Center, Nordoff Craniofacial Foundation. Okay, hold on. Yeah. So let me share my slides so that everybody can hear. I see some questions. We'll have an opportunity to ask the questions later, if that's possible. No? So we'll just hold on po muna. No? Here we go. Right. So let me play that. Okay. Everybody sees my screen. At this point, I might not see the chat, no? So I'm hoping that our MCs, Ina and Rina, will take a look at the chats and pull everything together. Let me share my story like Gwen, kasi may story din ako. When I was a resident, I started in a hospital where Operation Smile began. Operation Smile was ahead of Smile Train when it first opened. No? But what happened was there's a lot of surgeries that were done by foreign surgeons. And then when they left, naiwan yung ibang surgeries dun sa hospital namin. So, inoperahan namin. And it started the ball rolling when we tried to put many different elements into place. So ngayon nakilala siya na parang Cleft and Craniofacial Center. Yun yung St. Martin de Porres. During that time, we would still go to missions outside of Metro Manila, I went to all of the islands. No, we went to Mindanao, we went to Bicol region, we went to kahit binabagyo kami sa Catanduanes, katabi namin yung weather station, nag-oopera kami. Nandun kami sa loob ng elementary school. Doon kami billeted. I remember one time na billet pa kami ni Dr. De Villa sa isang motel kasi yun lang ang pwedeng puntahan namin. So nag-oopera kami kahit saan. But after a while, parang naramdaman ko na hindi ko nakikita, hindi ko nababantayan yung pasyente ko. So ang nangyari, nag-dream kami ng continuing care center. Yung makikita namin yung pasyente namin lumalaki, tumatanda, nasusuportahan namin kada step of the way ng pagtanda nila. Tapos umalis si Dr. De Villa, nagpunta siya ng Taiwan, na-meet niya si Dr. Nordoff. At sinabihan siya ni Dr. Nordoff, may pagkakataon ba na gumawa ng continuing care or complete care center sa Pilipinas? At sabi ni Glenda, uuwi ako at titignan ko. Pag-uwi ni Glenda, ni Dr. Glenda De Villa, nag-usap kami at nasabi niya sa akin yung kanyang dream. And I told her about my dream. I told her, I know I want a white hospital with a playground, with children running, na meron silang deformities of the lip or whatever, it's not, cleft lip and palate, pero happy sila. No? So yun yung sabi kong dream. And when we found Our Lady of Peace Hospital, we started operating in 2003. And then lumaki ng lumaki ng lumaki. And then our Taiwan counterpart said, baka kailangan nyo na magtayo ng sariling foundation. And that's when Lord of Craniofacial Foundation started. No? So we were founders. And then we started to pull everybody together. Sila Dr. Pandan, Sir Paolo Sison, and then later on, Dr. Pandan Sipek, and then dahan-dahan dumami kami. No? At si Dr. Benji Cabrera, meron pa kaming ibang mga ENT at saka pediatrician. So that's the whole story, how it started. It's a desire to give long-term care for patients with long-term needs. Naintindihan namin na lumalaki kayo. No? So, yun. So, dati puro mission ang ginawa ko. Let me see. Yan. Puro mission. Nagpupunta po kami sa... nagro-row, yung isa akong picture dito, nagro-row ako. Ito, bata pa ako, may braces din ako. At ito yung grupo, ito si Dr. De Villa. No? Ito yung kasama namin na residente. At ako ay nag-opera ng labi dito sa isang shot na to. So, it was rewarding, but I think there was a greater desire to watch our patients grow. And so, that's when we decided to, upon the encouragement of Dr. Sam Nerdoff to build Nerdoff Craniofacial Foundation. So you are all part of that history habang tumatanda kayo. Sabi ni Gwen, yung ilang taon lang siya, na-operahan na siya. No? So you are part of that history. And every December 3, we have a mass for Dr. Nerdoff because that's the death anniversary of Dr. Nerdoff. No? And it is with thanks that we offer our prayers for him. No? So anyway, let's go to the meat of the matter. So every patient, gusto namin, nakikita namin ng kabataan hanggang lumalaki kasi nag-iiba yung needs ninyo habang tumatanda kayo. No? Nakikita niyo yung ilong niya dito, dapa ng kaunti. So you had to do a little bit of adjustments as she grew up, as she aged. And it is a rare opportunity for doctors to see their patients from 3 months old to 16 years old. No? So this is our journey together. So when we face the world, we face it together. No? Because what we like is that you like yourself. We like you to see yourself in the mirror and say, I'm happy, I like myself and I can do everything that I want to do in this world, that I was, your mission in this world and your dreams. We want you to be able to reach your dreams. So that's a complex thing to say for me, no? But especially for you guys, it's hard to pin down your dreams and say, I'm capable of doing these things. But along the way, what we want is to parang itemize what is your need. No? So I know that in the beginning, kailangan huminga ng bata pagka pinanganak siya. No? Kailangan maganda yung paghinga ninyo. Kailangan nakakalunok, kailangan nakakakain, kailangan maganda ang speech at a certain time in your life. Kailangan nakakarinig kayo para nasasabi nyo ng husto yung words because it's hard kung meron pandinig na problema. And then ang ngipin ninyo, importante rin sa pagsalita, sa pagkain. Kung hindi sila aligned, hindi nyo masasabi certain words like T and F and S. Those are hard words, right? So also, pag tinignan kayo ng ibang tao, meron minsan yung mata nila kasi kondisyon na nakikita na ang labi buo, ang ilong, symmetric, ang pananalita a certain way. So it's not their fault that that they perceive you as different, no? But I'm so happy that the environment now, our world now, is more inclusive, no? So ngayon, parang when you are different, they know, the difference is not difference in your heart, that difference in your brain. No? There are just differences like the color of your skin, your hair, your body type, and all that. No? So all of these things will amount to some social development. And I think that it's important for you guys to reach that point where you are socially developed. Kasi you are capable. All of you are capable. And so we don't want that, for example, no, sabi ni Gwen kanina, wala masyadong funds to be able to do certain things. No? We don't want you to have an additional risk. Yung financial risk na mabubuli kayo, magiging socially, ano kayo, no? Anong matatawag doon? Hindi malakas socially or whatever. Baka makapigil sa pag-fulfill ng dreams, no? At pag-fulfill ng pangangailangan ninyo. So that's part of what we do in NCF. And that's why si Ma'am Van is doing a lot of psychosocial programs for our patients. No? Okay. So all of these things we want to do at the right time, at the right pace. Kaya lang hindi lahat nagagawa. Kasi iba-iba tayo ng schedules, iba-iba tayo ng kakayanan, malayo yung iba, malapit yung iba, hindi pa kompleto yung aming serbisyo. Pero we aim to complete it. No? All right. So just so you know, yung mga mommy dito, nasan ba yung mga mommy? Ang bata, nagka-develop ng cleft on the first trimester, no? Usually on the 7th to the 8th week, nagmamanifest na yan. No? So, pagka later in your pregnancy, 7th month, tapos nadapa kayo, wala nang effect yun. Ano? So, pagdating ng 3rd month, 14th week, gawang-gawa yung bata at makikita mo na sa ultrasound yung cleft. So, mapaghahandaan ng maaga. Okay? Tapos, alam ko maraming naiisip na mga reasons kung ano yung bakit nagkaka-cleft. Pero ang dalawang main ay unang-una may mga switch yung katawan natin, genetic switches ang tawag namin doon. At meron ding switch na nanggagaling pas. Kunyari, na-on yung genetic switch pero hindi na-on yung switches sa labas, hindi mangyayaring cleft. Pero pag na-on sila lahat, para siyang lock, yung pagka nagkabit-kabit, dadaan yung cleft. No? So nangyayari yan ng spontaneous, ibig sabihin sa maraming mga sitwasyon, hindi siya namamana, spontaneous nangyayari. At meron din mga sitwasyon na parang may pinsan ka na malayo, na may cleft, tapos may switch yung pamilya niyo at nasi-switch on siya. So let me talk about cleft lip. Maraming ibang klaseng cleft, no? Maaring hindi buo, maaring buo, at merong dalawa buo ang nagagawa. Tapos maaring malapad at hindi masyadong malapad. Malayo, meron nandun sa kabilang side yung cleft, no? At meron naman napakalayo sa harap. So, yan. Tapos kasama ng cleft deformity ay yung nose deformity. Alam natin ito, no? So, ito ay mga bagay na alam ng mga doktor at pinag-aaralan namin na paano natin siya lahat itutuwid. So, let me just stop this first. Okay, so I'm going to skip to this and show that you normally what you will hear is chyloplasty will happen at certain schedule, no? 10 pounds, 10 globin. Ito yung lagi natin naiisip dati, no? Pero kami sa NCF, kailangan healthy yung bata, wala siyang sakit. Ang potential na mag-heal ng bata ay naroon at nandiyan ang pediatrician natin. So, yung plans of repair din, maraming magsasabi sa inyo, ito, nakikita nyo. Siguro ito yung mga landmarks na makikita nyo sa NCF. No? Yung chylorhinoplasty, makikita namin yan. Gagawin natin at 3 to 6 months. Ngayong pandemya, namumove yan ng kaunti dahil hindi lahat ng bata ma-ooperahan namin at the right time. At hindi naman malaki yung risk kahit na ma-delay tayo ng kaunti. Itong palatoplasty ang medyo may kaunting risk dahil nagsasalita na yung mga bata at a certain time. At pag nakasanayan nila magsalita na meron silang palate na opening at hindi nakakabit yung kanilang mekanismo para magsalita, minsan nasasanay sila na gano'n na yung pananalita. So in terms of chyloplasty and palatoplasty, I would say that the palatoplasty has a little bit more, mas time sensitive, no? And then the bone graft, tinahabol din namin to dahil meron ding magandang panahon na gawin yan. And then orthodontic surgery, this one we can do a little bit later because hindi risky na ipag-postpone ng kaunti. So let me tell you yung periods ng treatment. Prenatal period, ibig sabihin buntis pa si mommy, nakikita na yan, Cleft, at kailangan na-educate na sila, no? Nasasabihan na ng pediatrician na ganito po ang gagawin natin, pagkapanganak na pagkapanganak, papa-newborn screening natin kung may iba pang mga problema, at kailangan ng advice kung paano sila ino-nourish at i-feed. And then sa newborn screening, may hearing assessment na, at i-refer na kaagad sa sa craniofacial center like ours. And so we receive them as soon as they are born. So as early as possible, gusto na namin nakikita ang mga bata. Ito yung nakikita natin, prenatally, makikita nyo na ni Cleft kung maganda ang posisyon. So yung feeding, tinuturuan namin kaagad. Pagdating ng mga bata sa amin, sa first appointment pa lang, tinuturuan na namin kung paano mag-breastfeed. Tinatry i-push ng aming pediatrician na mag-breastfeed ang mga nanay na may cleft lip and palate ang mga anak, no? Dahil kaya nila. Basta meron lang posisyon at merong tamang pag-aaruga. Minsan mas matagal dahil paglunok nila ng milk, nakakalunok din sila ng hangin. Hindi sila nakakasuck, pero nakaka-squeeze sila. No? Napakagaling ng mga bata na matuto kung paano kumuha ng pagkain. It's instinctive. So we really want to push, breastfeeding. Kung hindi naman makaka-breastfeed ang bata, maraming paraan kung paano sila magkaka-supplementation, and our pediatrician gives high-calorie supplementation ng mga ibang milk, no? At binibigay yan with special feeding bottles. I think I have a special feeding bottle somewhere here, but that's something that we do. Okay. So yung 0 to 9 months, ito na, nutrition and feeding na tayo, no? Tapos, magkakaroon na ng paglinis ng bibig para yung mga natitira na milk ay hindi nag-stay sa loob ng bibig. Tapos, nag-nasal-alveolar molding na tayo. Ito, 0 to 9 months. In fact, earlier on, 0 to 3 months ang nasal-alveolar molding namin. Maaring tumagal hanggang 5 to 6 months, no? Bakit natin ginagawa yon? Kasi yung mga clefts, nakita nyo kanina, no, ang lalayo ng mga, nung right side and left side. We can narrow that, and we can even influence the gums and the bone to move together. Dahil dala nila, pati yung base ng ilong, nagiging mas central yung ilong. At makikita nyo yon dito, no? Mas nasa center na yung ilong. So, the lip and nose treatment starts with nasal-alveolar molding. All right. So ito makikita nyo, ginawa ito ni Dr. Cabrera, one of our orthodontists. Ito yung hindi siya pantay, no? Tapos mas pinantay na niya. At ang baby ay mas diretso yung kanyang repair after surgery. This is also the same patient. This patient, I believe, is the other patient, the 16-year-old that you saw earlier. No? So, 16 ba siya? 2007? Shouldn't be. Hanggang lang siya, 14 lang yun. But I have a photograph of this baby that's older na. No? So, makikita niya nag-iba na. All right. So again, I was telling you, our pediatrician takes care of the baby, make sure that there are no other comorbid problems like heart disease, baka mababa ang hemoglobin, baka meron kaming mga blood dyscrasias. Yung blood dyscrasia, yan yung mga sakit sa dugo na hindi kayo nakaka-produce ng maraming hemoglobin. Ano? Yan. So, napag-usapan namin yan dahil minsan kailangan i-refer out pa namin ang mga pasyente para lang namin matreat sila. So this is Dr. Benji Cabrera. He's been our devoted pediatrician, and he's the one who he's a gatekeeper. Huwag niyong operahan yung bata kasi hindi pa handa. No? Siya yung gatekeeper namin. So we support his efforts to do that for us. No? Now, this is what I was telling you. Pagka kailangan niya i-supplement yung bata, kunyari mabagal yung pag-breastfeed, kailangan i-supplement. At binibigyan namin ng maraming different options kung anong pwede nilang gamitin ng mga feeders. Itong feeders na ito, mga mommies, no? Kung nakikinig kayo, nasi-squeeze niyo ho sila. So parang instead na yung bata, nagpapagod siya na mag-squeeze, pwede niyong alalayan na mag-squeeze. And so these are specialized and these are available in the market. Nakuha ko tong pictures na to sa Lazada yata or sa Shopee. No? So you can do that. Okay, now let me tell you a little bit about cleft surgery because this is the next phase at 0 to 9 months. Ito yung ginagawa natin. Yung cleft lip na discontinuity, hindi siya nagdikit dahil ang katawan natin, habang nasa sinapupunan, para siyang bread na fina-fold. No? Parang fina-fold, dapat nagdidikit sila. Kung hindi sila magdidikit, magkakaroon ng cleft ang bata. No? So minsan hindi sila nagdidikit kasi ang ingredients hindi tama at may switch na hindi na on or na off or kaya hindi sila magdikit. No? So makikita nyo, ito yung mga muscles na pang-smile, panghila sa gilid. Na? Nakikita nyo na nakadikit dun sa ilong yung iba. Kaya parang napupush. Pag ngumiti ang bata, mas nahihila pa mas lalo. So, you can superimpose the cleft and see, kung baga kami, yung mga doktor, para kami may x-ray vision, sinisilip namin sa loob kung ano itsura. No? So, if you can just put it on top, ganyan ang mangyayari. Pag may repair, dapat may x-ray vision din kami. Dapat na ididikit namin yung mga structures kagaya niyan. No? So if you superimpose a repair on this, it should look like so. No? Na diretso mo itong muscle na to, tapos yung ilong na i-tuck in mo ng husto, dun sa spot kung saan siya, dapat nasa center. No? Tapos dapat mataba ng konti yung sa may labi. Para that's how typical lip would look like, para silang pinagdikit. So medyo may kakapalan at the lip area. No? And then you wait for it to grow. You wait for it and watch it grow. Kung makikita niyo, meron kaming mga bata na pinapa-massage namin pag pumapalang mga labi. No? So ang mga scar. So kailangan namin bantayan yun. Hindi pwedeng uuwi na kayo ng malayo tapos hindi namin kayo makikita. Kinakabahan kami pagka gananan. So, yan. So, singular lip, singular cleft, one side only, will have to be symmetric. Kailangan yung skin, yung muscle sa loob, at saka yung mucosa sa loob. No? Tapos, kasama dyan yung cartilage ng ilong. Kung bilateral naman, pasensya na at medyo tinanggal ko nga yung blood, yung tone nito na ginawa kong less red. Pero para lang makita nyo na this is how it will evolve for you guys. No? Yeah. Para magawa natin yung sinabi ko sa inyo na yung anatomy, pinagdidikit ng gusto. Pagdating ng about 6 months to about 3 years old, no? Kunyari na-operahan na yung labi, magsa-start na ng pediatric dentistry, maglalabasan na yung mga ngipin ng bata. No? Tapos ito, diet development. Importante sa amin yon kasi ayaw namin mabawasan ng ngipin ng mga bata dahil yung ngipin nila, parang pinapag-grow niya yung panga ng mga pasyente. So pag lumabas yung mga ngipin, lumalaki yung panga. Pag nabunot yung ngipin, bumabagsak yung panga. At risk na nga yung mga patients namin for growth. No? So kailangan namin ng tulong ninyong lahat para yung diet ng mga patients nag-i-improve. And then our pediatricians, pediatric dentists from Pediatric Dentistry Center, sa May Banawe, sila yung nakikita nyo nag-knee-to-knee, tinuturuan ng mga mami as early as possible, turuan ng mga bata na maging masaya ang paglinis ng ngipin. At yun ang next phase. Tapos, syempre magsasalita na yung mga bata. Tinuturuan na namin sila, magbabble na sila, mag-say na sila ng letter P, letter B, para preparation for the palate surgery. Tapos hearing assessment has to be done at this stage and we can send them for audiology. May partners din tayo for audiology. And then we do the palate repair. No? Okay. So ito yung mga pediatric dentists natin, kung hindi sila naglilinis ng mga ngipin, nagtuturo sila sa mga parents. And we want you to be ambassadors for them also. Kasi hindi nila kaya lahat turuan. No? So kung alam niya, ay sasabihin nila, you just chismis na lang sa kapitbahay niyo dun sa OPD natin. Alright. So this is the plan. Na matuto yung mga bata kumain ng healthy very early in their lives because we need them to be healthy and we need all the apparatus in the mouth to be healthy. No? All right. And to avoid certain foods if possible. Very high calorie kasi lahat ng mga pagkain available sa mga bata ngayon. No? There's a lot of cake, cookies, donuts, a lot of fruit juices, and they're very easy to grab kasi lahat ng retail stores, mga sari-sari store ay meron yan. So, at masarap sila. So, okay. So, I want you also to understand that ito na yung palate surgery. Yung palate, kagaya ng labi, ay iba-ibang degree. Merong konti lang. Pero ito, yung konti lang na to, pagka nilagyan nyo ng ilaw sa loob ng ilong, makikita nyo parang blue yung dito. Kasi yung muscle, hindi pa rin magkadikit. No? So, maraming ganun na kaso. Kaya kahit na kaunting-kaunti lang, yung hindi pagkakabuo, yung mga muscle dito hindi rin buo. So, kailangan din silang i-repair. So, minsan, mas malaki. Tapos, yung hard palate, itong tinatawag namin hard palate, may buto dyan sa loob, buo. Meron din yung tuloy-tuloy at meron din yung dalawang sides. No? Alright. So, the repair of that, I will not describe to you much. I don't think I inserted that. Hold on. Huh? Oh, we have a repair. Sorry, we have a repair ply in the bottom. Let me do that again and play it for you. Okay. Yan. Tapos si Sir Paulo Sison is our very dedicated also na speech and language pathologist. No? Hindi sila speech therapist kasi hindi lang sila nagka-therapy pero nagda-diagnose sila ng problema kaya speech and language pathologist ang tawag namin sa kanila. At a certain age in the care of our patients, we start them on speech and language pathology sessions. So tinitignan niya kung merong speech yung na problema yung bata o merong kailangan silipin yung ilong kung talagang nagsasara yung ni-repair namin na palate. Okay? So, siya rin ang nagsasabi kung kailangan natin ng panibagong palate surgery para madagdagan yung repair. Minsan kailangan natin yung gawin. And I'll show you later the repairs that we do. No? Yan. Ito yung isang evaluation na ginagawa niya. Naglalagay siya ng camera sa loob, sinisilip niya. Pero itong camera na to, umaabot dito sa larynx. Yung camera niya, dito lang niya pinoposisyon para pag nagsalita yung pasyente, nakikita niya kung nagsasara ng maayos dito sa likod. Maaari din natin ma-send for real-time MRI. We can also do some video fluoroscopy. Ito yung nag-X-ray. Pero may iniinom yung bata, tapos nagsasalita sila. So nakikita. Pero mataas kasi yung radiation nun, kaya hindi namin yun masyadong ginagawa. As gusto namin radiation that is very low, yun lang ang ginagawa natin. Alright. So pag alam na natin yun, then we can decide kung gagawa ng additional na palate surgery. And this is a Z-plasty. Parang pinapahaba pa mas lalo yung repair. No? So maganda ang rate of speech. Tawag namin doon ay velopharyngeal insufficiency. Mababa. Ibig sabihin hindi nagsasara ng maayos, no? Insufficient yung velopharynx para siyang yung kurtina sa likod, yan, no? Yung velopharynx. So hindi siya nagsasara ng gusto pagka may VPI ang mga pasyente natin. All right. Okay, now we go to 6 to 12 years. Okay? Pag 6 to 12 years, naglalabasan ng permanent teeth ng mga bata. No? So kailangan handa na kami maglagay ng buto kung saan lalabas ang very important na ngipin, which is your canine, no? Yung parang pinakamahaba ng ngipin. So nag-orthodontics na kami minsan bago mag-bone graft at minsan pagkatapos na ng bone graft, no? So ito, gaya nito, ito yung canine, lalabas. Kailangan palakihin ng kaunti yung letter U ng panga para lang mai-accommodate lahat, para mai-linya-linya natin lahat ng mga ngipin. Yan. Yung alveolar bone graft, kasi pag tinignan nyo, napakaliit lang nung cleft minsan. Pero sa loob ho, ang itsura po niyan, naalala niyo yung sinabi ko, yung pagka nasa sinapupunan, fold yung mga cells ng katawan natin at dapat magdikit. Yung kanan at kaliwa, hanggang sa dulo, pag finold mo, hindi magdidikit kung maraming kakulangan dun sa proseso ng pagdikit. No? And so the alveolar bone graft area is like a pyramid na ang dulo ay nandun sa loob, tapos nasa harap yung base. No? Yan, so may ganyan siya. So, again, kailangan may x-ray vision kami pag ginagawa namin yan. In other centers in the United States, for example, they get a CT scan just to determine tayo, x-rays tayo. Matipid, mababa ang radiation, and it's been appropriate for us. No? I think that in the future, we might also consider having CT scans kung kami ay papalarin at lumaki pa mas lalo yung center natin. Oh, sorry. This is about 15 to 20 years of age. We go for orthodontics, dental care, orthodontic surgery. Again, speech assessment. Kasi baka nag-iiba pagkatapos ng orthodontic surgery. Pag dinala natin yung inyong jaw forward, baka hindi na magsara ng husto yung kurtina sa likod, yung velopharynx. No? So, kailangan natin gawin yon. And then, pagka ginalaw din natin yung upper jaw, yung ilong, nag-iiba. No? Si Gwen, remember Gwen, I told you, no? Na isa sa debate natin, kailan natin i-repair yung upper lip. No? So kailangan ito pag-aralan ng gusto kung alin ang mauuna, yung orthodontic surgery, yung lip and nose revision, para maganda yung resulta na nakalalabasan. No? So gaya nitong isang bata na to, kailangan hiningi ko sa aking orthodontist na paki-align niyo muna bago ko lagyan siya ng bone graft. Tapos pagkatapos itong ngipin na ito kasi nakalabas masyado, no? So pag nilagyan mo ng bone graft, at saka i-repair mo yung lip, nakalabas na gano'n. So hindi masyadong aesthetic yung kalalabasan sa kanya. Kaya na pag we agreed as a team na sige, we'll repair the lip and then we'll do some orthodontics and then we'll see and see if we can finish it if we don't need any more orthodontic surgery. And ganun ang nangyari. So matagalan siya na proseso para sa mga bata. At ito isa sa mga kaso na matagal, nagpunta siya sa amin, na-repair na yung labi niya. We had to re-repair. And then, syempre may scar na. And then, nag-start kami ng orthodontics. At na-operahan na yung kanyang upper jaw. At tuloy-tuloy ang kanyang pag-aral. At siya ngayon ay gainfully employed. Pero hindi yung aming treatment ang nakagawa noon para sa kanya. Talagang desidido lamang siya. No? So, nakakatuwa na makikita mo yung pasyente na hindi ka na kailangan. So, isa siya sa, I would say, the satisfaction of a doctor doing this. No? Na hindi ka na kailangan ng pasyente mo at they are very independent and very settled in what they like to do, and they're reaching their dreams. So I want you to know that throughout all of this treatment that we do, consistent na mula kabataan hanggang pagtanda ng bata, sinusuporta natin sila psychosocially. Kasi bago kayo pumasok sa eskwelahan, ang mga bata, masaya kayo sa bahay, wala kayong masyadong wala kayong masyadong ibang tao na nakakasalamuha, your friends are there, your family, your support. So kailangan malakas na malakas yon sa first phases of the life of a child. Pero pag pumasok sa school, kailangan merong support na kayo kasi kagaya nyo sinabi ninyo, minsan nabubuli, no? because other kids do not know also how to treat the difference that they see, no? Hindi dahil masama sila or ano, no? But hindi sila siguro nakakakita na kakaiba sa bahay din nila dahil lahat sa bahay nila iba-iba kapamilya din nila, no? So, and then all throughout we say that the oral hygiene is very important. Oral hygiene and dental care kasi yan yung bakal ng mukha. Kailangan namin sila hanggang pagtanda ng pasyente. Tapos on our end, yung team kailangan nagtitreat na nakikita namin kayo lagi para pag meron kami nakikita na bakit nagkakaganto ito, magkakaroon ng interceptive treatment immediately. Depende na dun sa, hindi kasi siya parang recipe. Every patient is different. Minsan, taga Mindoro, so iba yung schedule na pinagdadaanan niya. Tapos, it's very important for us to keep records and documentation. Hindi nyo nga papansin, every time you come, lagi kami nagpipicture, no? Picture kami ng picture. The first 6 months of this kid, I had to take pictures, no? Kasi nagko-contract pataas yung kanyang labi, no? Tapos makikita nyo pag nag-contract pataas, kailangan i-massage and all that. But, eventually, you will see it evens out, no? So, hindi mo yun malalaman kung nandun ka lang sa mission na, I know the mission has its purpose, but that's the reason why we wanted to build this center, because we wanted to see if we were effective, if there's anything that we can change, if there's anything that we can improve or deliver better, no? So, ito rin, isang pasyente na dahan-dahan natin binabantayan hanggang pagtanda. So, it's very important for us to keep our records. And now, Ma'am Van has been trying to put up an online records keeping system for us so that we can successfully do this na kahit wala tayo sa clinics, pwede natin gawin online, no? All right. So here's another case. We're seeing this patient. We're trying to see if the nose will be stable. Nakita niyo yung asymmetry ng nose dito. We want to see if this was going to push through for the rest of their lives. This is again the other patient na ninam ni Dr. Cabrera, and then we had to revise the nose, and then we had to retain it lang with a retainer. And so let me go back there, and then the ABG was done, the braces was done. She didn't want an implant in this area. If you can see, no, kulang kami ng ngipin dito, pero ayaw na niya ng implant kasi masaya na siya. So like I said, yun yung endpoint. We want patients who are happy. So our long-term goal as doctors, no, with you when you face your world, is to deliver to you a symmetric nose and lip. Tapos gusto namin lumalaki yung inyong panga ng normal at wala kayong mga teeth na tawag dito na hindi nasa posisyon. Kung meron man, kailangan gawa namin ng paraan para hindi sila magiging wala sa posisyon. And then, kung kaya namin na hindi kayo mag-orthodontic surgery by doing the most meticulous kind of surgery in the beginning, mas maganda yon. Pero kung kailangan, gagawin natin siya. We also want you to have excellent speech. That's parang the gold standard of cleft lip and palate surgery. Even for craniofacial surgeries, we want excellent ang speech ng mga patients natin at ang growth maganda. No? Mas maganda na yung kurtina sa likod tumatama sa pag sinabi niyo yung ka or pa, you can generate the right pressures. No? At hindi nagsasound na parang pumapasok sa ilong yung hangin na mas marami. No? Also, we want to have 0 to minimal secondary palate surgery para hindi pa ulit-ulit ang surgeries ninyo. So, thank you. In a short span of time, that's the journey that we take with you as you go through your lives. And if you have any questions, yes, if you have any questions that are not answered here, I have posted below my email address. Thank you. Back to you, Ina. And I'll stop my share, okay?
All right, thank you so much, Dr. Velmonte, for enlightening us, especially sa mga parents and volunteer parents na kasama natin today. Ang ganda nung sinabi niyo, Doc, no, na we can face the world because we can face it together. And I like how our doctor's desire is to like ourselves and embrace who we are despite everything. Ako honestly, even if I'm not a NCFPI patient, I know how it feels to be discriminated and judged even in the workplace. And if you can notice, I also have some lapses na aking speech. I was born with a cleft palate, but I'm also a testimony that I can reach my dreams. Isa po akong manunulat. I'm a writer. I am also hoping to take up my masteral next month and a mental health advocate. And I can be confident also in front of the crowd. Dahil nga tulad ng sinabi ni Ms. Gwen, family support is so important. And my family has been my support system through the years. And I hope yung mga mommies dito, yung mga parents natin na nanonood ngayon will not stop from encouraging their children dahil very vital po ito sa kanilang character development. And so, bago po tayo matapos, may mga questions po na meron ang mga patients natin for Dr. Velmonte. So if you have any questions for the speaker, we're gonna go ahead and spend some time to answer them. So Ina, could you assist me please?
So the first question, good afternoon, hanggang ilang taon po pwede? Wait lang po. For the first question po, from Wenny de Malaog. Good afternoon, hanggang ilang taon po pwede mo operahan ang may cleft palate? And ako po 2 years old na may cleft palate.
Thank you, Ma'am Weni. No? Like I explained earlier, bago sana magsalita ang bata, maoperahan na natin yung palate nila. Pero, ang speech, nabubuo yan on the first 3 to 4 years of your life. No? So, lahat ng, di ba, nagbe-baby talk pa sila sa umpisa, no? So, yung pagbe-baby talk nila, hindi yan natatanggal hanggang mga 4 years old. So, we feel that interventions can still happen up to 4 years of age. Or the earlier, the better. 2 years is, I asked Sir Paolo before, sabi niya, 2 years. So, yun ang gusto ko sana na lahat sila na operahan at 2. But there's a pandemic right now. No? So you have to weigh what is safe for you and what is capable for the frontliners at the moment. So what we'll do is we have to catch up. We have to catch up with your treatments. No? Meron kaming mga pasyente, kahit matanda na sila ng kaunti, nag-improve sila. So that's our challenge. Kasi sa ibang bansa, parang on schedule sila eh. On schedule, bago magsalita, na-ooperahan na nila. Pero sa atin, we have more data na kahit na later natin inoperahan, nag-improve pa rin sila. Kasi determinado sila na mag-speech therapy, na nagagawa na nila ng paraan. No? So I think the motivation is something that works for us more than the right timing. Kasi hindi natin nagagawa na right timing all of the time. No? So huwag kayong mag-alala, Ma'am Weni. Just make sure that your child is healthy and we can still do the surgery at 2 years of age.
Pwede po operahan ng bata in 2 years old kung siya ay healthy po.
That's true.
Next question po, bakit po hindi pwede pagsabayin ang cleft lip at palate surgery? Thank you po.
Actually, pwede po. pwede pong isabay yung cleft lip and palate surgery. When a patient is healthy and the conditions are so that we can monitor the children very, very well, we can do that. No? Kasi yung cleft lip surgery, may kaunting wound ang pasyente. No? Yung cleft palate surgery, usually bigger na yung children, so they lose a little bit more of their weight during the period. No? So we just need to make sure that they have enough reserve and we can do it at the same time. Si Dr. Nordhoff ang nagsabi sa amin before na mas maigi na hindi natin pinagsasabay. Kasi kailangan natin makita kung gumagaling sila ng maayos. No? Kasi kung dalawa yung surgery na ginawa mo, tapos hindi sila gumaling, dalawa yung hindi gagaling ng maayos. No? So, I think hindi siya nagtitipid in that aspect. Sabi niya, bigyan natin sila ng pagkakataon na mag-heal. And I remember him saying that to us. No?
Okay po, Doc. For the next question po, medyo mahaba. From Belina Cano.
Okay.
2 years old, na-opera po ang anak ko, Cleft Palate. May konting butas pa natira. Pero habang lumalaki, natutunan na niya kumain nang hindi lumulusot sa ilong ang kinakain. Nakaya rin niya na magsalita nang naiintindihan siya. 24 years old na siya. Ngayon, need pa rin niya magpa-operate para magsara ng tuluyan. Need pa rin po ba niya magpa-opera para magsara po ng tuluyan niya?
Napakagandang tanong na ni Belina kasi kaya ng anak niya na gawin lahat, no? Kaya ng anak niya na gawin lahat. So, tatanungin mo sa sarili mo kung may benefit ba yung surgery. That's always our question to ourselves. Is there a benefit? Is there a higher risk for him? No? Kasi kung i-face niya pa yung risk pero walang benefit, it's not a useful surgery to the patient. No? You agree? Now, if you say na, okay, pag pumupunta kami ng mataas na altitude, hindi niya ma-clear yung tenga niya. Hindi niya ma-clear ng husto yung tenga niya. Kasi hindi siya nakakaswallow ng husto. Tapos pag sinabi mo, masasabi niya lahat, nakakalunok siya, hindi pumupunta sa ilong, pero lagi siyang merong upper respiratory tract infection. You have to know, no? Baka kasi yung tubig, tsaka pagkain pumupunta pa sa ilong niya. So you have to really determine whether it will benefit the patient. And you have to not only look at what is functional, you have to also clinically check the patient. Huh? So, kailangan natin siguro i-check up at determine together.
Okay. So our next question, Doc, from Carla. Hello po, Doc. Patient din po ako ng NCF. After ko po ma-operahan, maayos na po ako magsalita at maayos na. Tanong ko lang po, if magbubuntis ako, may vitamins po ba na dapat inumin para hindi maging cleft ang baby?
Alam mo, maganda din yung tanong na yan, no? Pero it's your obstetrician who will take care of you. They will give you the right vitamins, no? Alam naman natin na nagba-vitamin supplement yung mga yung mga nagbubuntis, no, meron silang mga vitamin A, folic acid. So may ganyan na nangyayari. Pero apart from the regular vitamins, walang extra vitamins na cleft lip and is cleft lip and palate and craniofacial awareness month, awareness and prevention month. Di ba, Jessica? Okay.
Yes,
Yung prevention part is actually more environmental. If you can avoid being in an environment that has smoking, that there is alcohol, if you can prevent yourself from taking alcohol, or other unnecessary na medications, it would be better for you, no? Yun lang. Hindi naman wala namang vitamins na kailangan. Basta your regular obstetric prescribed vitamins should be taken.
Okay. Mukhang wala na tayong questions. May other questions po ba from our participants? Feel free to unmute. Yes. May other questions po po?
May comment po nasa chat box. Meron po atang question pa from Gracie Villa.
Ayan. Si Gracie Villa, ito po, Doc. Hello po, Doc. Is it normal po for the cleft patient na kapag may cough and cold po, medyo humihina ang hearing, left or right or both? Thank you, Doc.
Hi, Grace. Kailangan makita natin kung nakakalunok ka ng husto sa likod, no? Kasi meron tayong tinatawag na eustachian tubes. yung eustachian tubes, konektado yan sa middle ear nyo, no? So pagka umaakyat tayo ng Antipolo or Baguio, kailangan parang lulunok tayo kasi nararamdaman natin yung eustachian tubes natin, parang napupuno ng pressure, no? So kailangan lulunok ka para ma-release ng pressure. Ngayon, minsan, pagka meron kayong cough and colds, nagkakaroon kayo ng clogging ng eustachian tubes, tas hindi gumagalaw ng husto yung tenga parang tambol, no? So, kaya parang nabibingi kayo. So, kailangan lang ma-check ninyo kung talagang nakakalunok kayo ng maayos, kung nabubuksan nyo ng husto yung eustachian tubes nyo. At nasisilip yan ng mga ENT natin, ng mga colleagues, para makita nila kung ano. Kasi kung hindi talaga gumagalaw ng husto or mahina ang paggalaw, maaaring mangyari na nagkakaroon tayo ng deafness, no? During periods na may colds. Tapos, isa pa sa kailangan ninyong malaman is you have to be proactive. Pagka nararamdaman niyo yan, you have to have decongestants. So, kailangan magpatingin para hindi matutuluyan na humina yung paggalaw ng tympanic membrane at saka laging clogged yung eustachian tubes.
So, okay po. May question pa po ba na iba? Parang wala na po. So, ayun po. Thank you po, Dr. X, on behalf of everyone who joined us virtually for being with us and sharing your expertise with all of our participants. Ang mga kasama nating patients po and parents ay nagkaroon po ng mas malalim na understanding ukol sa comprehensive cleft care.
And that's right. And as we conclude this webinar, we'd like to thank again Dr. Xenia Velmonte for a great presentation and for Ms. Gwen for sharing her story, as well as all of the participants who took the time to attend. It was wonderful having you here. And so, dito po nagtatapos na ating webinar. Thank you again to all the volunteers, parents, and patients who attended. We hope that you learned and enjoyed this webinar. See you next month. And I'm Rina Ramirez and Ina?
I'm Ina Black.
Thank you so much, guys. Miss Jessica.
Thank you to Miss Jessica, who has
Yes.
been very hardworking.
Thank you po, Doc X. And Rina and Ina and Gwen. Thank you so much po.
Thank you
Kaka-remove
po.
ko lang po na, kakastop ko lang din po ng live natin sa Facebook. Pwede po tayong mag-take a picture. Wait lang po.
Of course. Of course.
Di man kaya po mag-open ng camera. Wait lang po.
Ayan, dyan pala si Ma'am Grace. At saka si Jillian is here. Hello. Si John Lawrence Ramos. Ito, ilang taon ka nung inoperahan kita, John? Lawrence. He was very, very young. Very, very young. And now he is, how old are you now?
Po at, 16 na po ako ngayon.
Oo, 16 na siya ngayon.
Okay po. Let's take a picture.
Alright.
And 3, 2, 1, smile. Okay po. Wait lang po. Double check ko lang po. Isa pa po. Last one. And 3, 2, 1. Okay na po. Thank you so much po sa lahat ng mga participants. And kay Doc X po, thank you so much po, Doc. And
Thank you.
Rina, Ina, and Gwen. Thank you po.
Thank you
Alam,
everyone
ganina
po.
po.
Ingat.
Thank you. Thank you sa mga MCs din. Galing.
Oo nga, thank
Thank you
you.
po.
Jessica, again, thank you. Van, naka-order
Yes,
na
Doc.
kasi ako ahead.
Okay, no problem.
Okay lang. Hanap
Yes,
na ako
yes.
ng baka gustong dumagdag. Baka sa mga patients natin, meron gusto ng, ano tawag dito, ng flu vaccine.